Hello, I'm Dr. Mariana. Happy and grateful to have opportunity to be able to share my knowledge in this ACC conference. It feels like 2 years has gone so fast since the conference in Bali. So today, I think that we will talk about an issue that is quite important during this pandemic, namely anxiety. There are at least 4 reasons I raised this topic. I think that is because the first, anxiety disorder is one of the most striking mental issues during this pandemic. WHO reported anxiety disorder has increased and brought concern during this pandemic COVID-19. And anxiety disorder has impacted many aspects, not only psychology, but also physiology, life function, relationship, and spirituality. The study also showed that anxiety disorder is often not handled properly and will develop into other psychological disorder. And then the other thing that I think the limitation of the verbal counseling, that is why we need to do some integration to work on anxiety disorder. Here today, I will present how Sandplay therapy, which is found to be effective in treating a complex anxiety disorder, but rarely people know that can be used integratively in dealing with anxiety disorder. Okay, we start. First of all, let's look at anxiety data during this pandemic. WHO reported anxiety disorder increased during this pandemic, where children are also reported to experience the same anxiety, worry, fear as adults, which then result in a decreased immunity, illness, death, and even suicide. APA survey in 25th March 2020 reported that nearly half of Americans, 48%, are concerned about the possibility of contracting COVID-19, and nearly 4 in 10 are worried about getting seriously ill with COVID-19, but far more, 62% are worried about the possibility that their family and loved one will caught by COVID-19. In Indonesia, a survey reported by Indonesian Psychiatric Association in May 2021 on self-examination patients, 65% of 4,010 patients reported experiencing anxiety. So anxiety has not only worsened with the spread of the COVID-19, as we know, but also exacerbated by the various news from the social media. Anxiety become the biggest issue, not only in Indonesia, I think it for Asia and a global issue. Anxiety is actually a common emotion and is a normal reaction to stress. It can be beneficial in some situations because it can alert us to danger and help us prepare and pay attention. So it can be happen to everyone, but an excessive and uncontrollable worry and fear that affect the function of life, so we call it anxiety disorder. So this is the differentiation between the normal anxiety and anxiety disorder. APA 2013 characterized anxiety disorder is a persistent, excessive, and uncontrollable worry and fear that affect many aspects of life, such as psychological, neurological, or physiological, and functional, and relationship. I think this includes spiritual. Studies show 33.7% of population are affected by anxiety disorder during their lifetime. As a Christian, I think that we are also not immune from this anxiety issue. Paul in Philippians 4, verse 6 to 7 warned the congregation not to be worried, but to give up their worry with prayer and thanksgiving. In Psalm also, David also realized that in his worry and fear, he sought God and asked God for help. So anxiety can be happen to everyone, including Christian or a faithful person. Also in Proverbs 12, verse 35, talk about that anxiety will will weigh down your heart. Anxiety is so real. It's right in front of us and maybe happening to us right now. Before we move to the next slide, let me share an assessment that you can use it to assess yourself. Here, I give you, that I present that we can use the G87 scale. If your result is moderate, please consider to professional. So take a while, and then you can screenshot and then do a self-assessment about your anxiety. All right, let's continue. Anxiety disorder actually is treatable, but unfortunately, many people with anxiety disorder don't seek help. They don't realize that they have an illness for which will affect treatment. A study showed that anxiety disorder that is not handled properly will develop into other psychological disorders, such as major depressive disorder, OCD, eating disorder, or panic disorder, or another psychological disorder. So based on clinical record and study show, often patients with anxiety disorder who come to the professional are already in the poor condition or with comorbidity that is increasingly difficult to treat. In this situation, we realize Christian ministry and counseling per se with a conventional form, it is not sufficient to address all the complexity of human problems. Specifically, in this case is anxiety disorder. As we also realize that counseling and outreach are inseparable aspects in realizing God's mission to bring koinonia in the midst of this world, which is the presence and involvement of Christ we experience it. Therefore, in this situation, I think we need integrative counseling to address the complexity of various mental illness, mental issues that occur. So today's workshop, we will see how we use Sandplay therapy integratively. Besides, we learn about GAD and a neurobiology of GAD. So today we will focus on generalized anxiety disorder and how GAD affects our brains. Let's start with definition of the GAD or generalized anxiety disorder. DSM-5 characterized GAD as an excessive, uncontrollable worry and fear about many things. So every single small thing for the GAD patient, they will feel worry and they cannot control their worry and keep feeling fear. Even though no clear object, sometimes they will feel worry about a number of events or activity occurring more days than not for a period of 6 months or more. This is DSM characterized about diagnosed about GAD. What's contributor or cause of anxiety? Studies show that could be stress, like now in the pandemic, stress, life experience, trauma of life pressure, financial or relationship, anything can cause the GAD. Brain chemistry, like a lack of serotonin or GABA in our brain can cause anxiety, and also personality issues such as neurotic personality can be easy contribute to anxiety. Physical illness that will contribute the GAD. So the presentation of GAD sometimes is not only psychological symptoms such as unrealistic excessive anxiety, worries that are difficult to control, or poor concentration, or mind going blank, or on edge, irritability. It could be like that. But the symptom also show by the behavior side, the hyperactivity or over controlling, or conversely numbness. This is for the person who tendency to be depressed, numbness, not too aggressive. For the aggressive, they will show that hyperactivity and over controlling everything. Physical symptoms. So GAD could be present in the physical symptoms such as a cold, nauseous, indigestion, muscle aches, restlessness, fatigue, muscle tension, or sleep disturbance. So these all symptoms, these all symptoms, this is somatic symptom or physical symptom. Often, the patient will seek help from the general practitioner rather than psychologist or counselor. So how this can be happen? I think that we need to understand anxiety disorder from neurobiological perspective. To understand the neurobiological of anxiety disorder, I think we need to understand the neurobiological of fear and worry. We need to take note that all anxiety disorder have two major symptoms. There are fears and worry, which affect whole behavioral disturbance. Anxiety and fear symptoms are regulated by an amygdala, the organ of amygdala. So we can put the cursor in the amygdala, and which is a center circuit. Worry, on the other hand, is regulated by a cortical striatothalamocortical CSTS loop. This goes to let's go to detail. Here is the circuit of anxiety disorder in brain. Actually, there are two routes in our brain when processing the emotional information that caused by our senses. One is the high road, slow road we call, or the cortex road. In this road, information passes from the thalamus and it is processed through the cerebral area or the cortex before it's sent to the amygdala, whereupon an autonomic and endocrine mediator of fear are engaged. We can see, yes, so see the cursor, yeah, that is a long route, yeah, to go through the cortex area. This is the normal route, okay. Another is the low road. We call it the instant road or fast road or subcortical road. We always call it quick or dirt road. Why? Because this is anxiety route. This is the anxiety disorder route, where the information that has been caught by the senses turn into exaggerated trait. This route, this circuit will similar with the trauma circuit, trauma people's circuit. It's like when you saw a danger of snake, I mean, and you snap. Okay, we can see see it in another slide. We can see in another slide, please. Yes, this is the high route where you can see this cortex router. And then we can see that the process it take a long way, yeah. And then from the for the short road or low road, yeah. The next slide, please. Yeah, we can see that like it's like that when we saw a danger snake and then we snap, startled, suddenly freeze or shock. Your heart rate will increase and feeling hypervigilance. And in this condition, your brain automatically engages an emergency not linked to its fear center, the amygdala. Once activated, the amygdala sends the equivalent of an all-point bulletin that alert other brain structure, such as spinal cord, which operate reflex response such as fight, freeze, and flight. The result is the classical fear response, like sweating palm, rapid heartbeat, increased blood pressure, and a burst of adrenaline. All this happens before the mind is conscious of having smelled or touched anything. So the fear response may affect endocrine, such as we can put a cursor when the amygdala activated the HPA axis, yeah, such as increase in the fear response may affect endocrine, such as increases in cortisol, which occur because of amygdala activation, the hypothalamic pituitary adrenal axis, HPA axis, and amygdala. When amygdala prolong the amygdala hyperactivity and prolonged HPA axis activation and cortisol release, that can have a significant health implication, such as increased risk of coronary artery disease, type 2 diabetes, and stroke. So we can see that's affect a lot to our physical issue. The most affected part of the brain is the limbic system, the thalamus, hippocampus, hypothalamus, and then amygdala. And then we know that this is a system that is connect one each other. And that's also affect the hypoactivity in cortex area. The cortex will be blocked when the amygdala hyperactivity. So in this condition, most of the anxiety people, they cannot processing the information rationally. Therefore, the reason why they are worried so much, uncontrollable worry, because the information, the prefrontal cortex shut down, and then the process of information being closed. Okay, and then so the prefrontal cortex will be blocked when the anxiety and hyperactive. Okay, so the hyperactive of amygdala, and then the anxiety too high. The fear response may be characterized in the part of endocrine effects, such as increase in cortisol, which occur because the amygdala activation of the HPA axis, like I said before. The overexposure to the cortisol and stress hormone will disturb all of your neuroendocrine system, and will disturb the neuroendocrine system. The biochemical and neuroimaging study indicated that the modulation of the pathologic anxiety stress is associated with multiple regions of the brain and abnormal function in several neurotransmitter systems, including norepinephrine, serotonin, GABA. So it is not surprised SSRI therapy is one that psychiatrists use to treat anxiety disorder. As an outcome of the chaos neuroendocrine system we produce, inhibit the cognitive function. Let's cursor put it the cognitive function, which is seen in the symptom of difficult to focus, memory impairments, dysregulation in emotions such as uncontrollable worry, stress, anxious, irritable, and physical response such as high blood increasing, insomnia, gastrointestinal issue, heart rate increase, and then breath also, difficult to breathe. Yeah, that will happen to our body. All these conditions will implement in the maladaptive behavior, such as over-controlling, hyperactivity, or conversely, anhedonia, numbness, and depressed. So from here, we can imagine how anxiety disorder affects so many aspects in human life. It doesn't only psychological, neurological, physiological, yeah. And then can we imagine that when we are over controlling, that's affect our relationship, and then when we cannot feel anything, feel numbness, and we cannot function well. Most of the time will affect also the spiritual realms. So a common treatment for anxiety disorder are pharmacotherapy and psychotherapy or talk therapy. If we look at the complexity and physiological effects of anxiety disorder, we become aware that talk therapy alone is not enough, especially patients with GAD. They often come with complaint that they don't even know the cause and find it difficult to talk to or verbalize. In this point, Sandplay therapy will work well to help clients to verbalize or talk the thing that they find difficult to verbalize. So let's see the Sandplay therapy. I think that Sandplay therapy is a multidimensional approach which is found to be effective in treating mental health and able to access subcortical in our brain. But few people are aware that Sandplay therapy can be used in Christian counseling or in counseling as a part of an integrative approach. How effective Sandplay therapy? Let's see. The studies show that Sandplay therapy is not only work effectively in treating anxiety disorder, but also variety of mental health issue on children and adults. So in my own experience in practice, I can see that how Sandplay works very powerful to help people with mental issue. Why it's worked well on mental health issue and brain, it is because Sandplay therapy has a capacity not only access to conscious, but also unconscious and subcortical level. So Sandplay therapy also has a capacity activated multi-brain system involve bodily sensation, intense emotion, creativity, driving cognitive change. So the multisensory aspect and the therapeutic relationship of Sandplay therapy are the underlying mechanism for change, which promote neural integration through the subcortical limbic cortical neural circuitry. The question is, how do we use this effective approach integratively in counseling? I think that there are some concepts that we need to make it clear before we do counseling and know when we do the integration. I think first of all, I think we need to understand the concept of integration. There are four important factors when we do the integration. First is the theoretical integration means that transcending diverse model by creating single but different approach. The second is technical eclecticism, means that we are using effective ingredients from different approach to find the whole. So the third is assimilative integration, means working primarily from within one model, but integrating aspect of other when needed. And the fourth is common factor. I think the common factor is the most effective way that we need to pay attention with. So the common factor, it means that we use a common tools, available approach that you already have, focusing on effective therapeutic practice such as a therapeutic alliance, client expectation, therapist empathy. I think that's the core of when we do the integrations. And study also show most of the time common factor therapeutic alliance has the most evidence as a predictor of patient change. Specifically, therapeutic technique, the study showed that therapeutic technique contribute about 7% on the outcome variance in the psychotherapy, while the common factor account for almost 20% of the outcome variance. So this is, I think, that the first important thing when we do the integrations. The second, I think that integration is not only theory and technique, the next slide, but also supported by evidence. It is very different with eclecticism. So this is differentiate between eclecticism and integration, where integration is not only the process of taking some technique from various models and applying them as needed, but it involves also the focus on the link between theory, evidence, and techniques. An eclectic therapy this is the difference here. The eclectic therapies, probably they will choose a technique because it may work or may be efficient without concern for its theoretical basis or research evidence. But it's very, the therapist doesn't necessarily investigate why the positive change occur in order to develop a generalized model of treatment. But in contrast, psychotherapy integration focus on the relationship between an effective practice and its theoretical and empirical basis. So this is very important that we need to highlight between integration and eclecticism. The third, I think the attitude in doing integration, I think such as humbleness, openness, and curiosity flexibility and trust the process and comprehensive thinking. So we don't stuck in one flag, one approach, and then we love one approach. So integration, that's it. We are open ourselves for the differences. We can see here, this is attitude that projecting us from the Christian value also. With this attitude, we are humbly learn to accept the diversity, new things, and differences. Thus, we can look at complexity of human issue in a more comprehensive way, I think the holistic way. Last, regarding the concept of integration, we are focusing to the client and therapeutic approach. We will choose the strength of Sandplay therapy and also aware of the limitation of the Sandplay therapy. For example, here I put it in the table, then we can see that the counseling or talk therapy different or similarity in their approach. Yeah, for example, in talk therapy, sometimes it's more directive, does affect GAD patient feel not being understood, or probably can be happen like that. It's because they will talk, but they don't know what's the cause of their anxiety. And sometimes it is because of their anxiety was so hard and they feel that they need someone to listen. But when we are confronted using the directive approach, and that it's very difficult, it's make the patient or the client very difficult to express their feeling and thoughts. Here we can see the use of Sandplay to help share. We can think about Sandplay. We can use Sandplay with please back to the okay. We can use Sandplay to help them express their thought, feeling through symbol. Sandplay therapy also can help them to explore the death issue or unconscious issue. By in Sandplay therapy, it's not only bring all the unconscious issue, but also can help them to work on the unconscious issue and bring it to the conscious without feeling being judged. Because in Sandplay therapy, it doesn't have we doesn't need to interpret the sand. I mean the picture. What is shown in the tray. Moreover, Sandplay with the play method help the patient feel safe or secure to express their feeling along with the neurological process happen as they manipulate the sand, choosing the symbol, and playing and processing their issue. So they will feel very safe and secure. So this therapeutic process is also supported by the genuine and relational therapies that help them to experience corrective emotional experience. All right, that's all the theory. So to be more clear, I will play a brief demonstration video and on how Sandplay therapy is used for the counseling. It's very brief, okay.
My tray, I'm done with it.
Yeah. Would you like to tell me about your tray?
Sure. So this is a couple, a bride and a groom. So they are like mereka itu kayak dikubur. Jadi kayak merasa kayak soalnya saya kayak ada sebuah mimpi gitu kalau misalnya if I want to have a marriage, I want it to be a happy marriage with someone that I love. Cuman kayaknya in the situation that I'm in right now, kayaknya itu nggak bisa tercapai. So kayak like my dream itu kayak terkubur gitu.
Buried,
yeah. Buried. Terus ini this little girl is me. Jadi kayak aku kayak lagi dikejar-kejar with my own fear. And yeah, I just want to run away from it. I cannot face my own fear, so I just want to run away from it. And this is a couple. The girl is like kayak lagi dicekik sama cowoknya. Cause I feel like kayak aku stuck di relationship ini yang aku nggak, that I'm not happy with. Terus ya jadi nggak bisa kemana-mana kayak stay in the place gitu. Terus this I feel like I'm drowning. I'm drowning, and kalau yang ini karena aku akhir-akhir ini ada masalah pencernaan, kayak asam lambung aku sering kambuh, terus susah tidur juga akhir-akhir ini. Iya, sering kayak dadanya sering berdebar-debar gitu.
I heard that you said that the symptom is already more than 6 months.
Yeah. More than 6 months.
Yeah. I really can imagine that how difficult that you cope with this issue. Yeah. Would you like to tell me more about the situation? I mean, that you said that previously you feel like you have an ideal in your relationship, and then but yang terjadi adalah justru you feel like kayak semuanya kayaknya udah terkubur ya, kayak buried di dalam relationshipnya kamu. And then how does it affect you now, the way you perceive your life now?
Yeah, so I feel like I'm stuck in this toxic relationship. Jadi pasangan saya itu sering kayak agak sedikit abusive terhadap saya, physically abusive gitu. Terus ya jadi saya kayak merasa saya pengen keluar sebenarnya dari relationship ini. Cuman ya I feel stuck, kayak yang figurines ini I feel stuck cause dia agak manipulative, like try to make me stay, like guilt trip me, jadi buat saya mungkin merasa bersalah gitu kalau misalnya I leave him gitu. Jadi ya mau nggak mau I have to stay, terus saya merasa stuck, nggak bisa get out of this relationship gitu. So jadi lama kelamaan jadi kayak mimpi saya mengenai happy marriage itu lama-lama terpendam gitu.
So you were saying that this relationship affect also your body. You mean that like included insomnia?
Yeah.
And digestion.
Yes, very much.
Any others symptom? I mean, that besides that?
And maybe I feel sering keringat. I feel like my hands sering ini keringatan. Sweaty hands, I have sweaty hands. Terus sering berdebar-debar, nggak karuan gitu. Terus sometimes agak sesak nafas sih. It's very hard for me to breathe normally sometimes. Terus
how about your body? That's any sensation in your body, like
oh yeah,
pain or what?
on my shoulders I feel very tense here.
Oh, I see.
Yeah.
Yeah. All right, Angel. Would you like to tell me, because previously you cannot tell me anything about, and you cannot express, and you cannot verbalize you and your emotion, and keep feeling cemas aja, keep feeling anxious aja, but you don't know how to tell your story. And then how do you feel with after doing this? And
I feel like I'm able to express my worries, my anxious feeling through these figurines. Yeah, so these figurines actually speak out to me, kayak my worries gitu jadi keluar di sini, jadi kayak secara nggak langsung mereka itu melambangkan my situation right now gitu. Jadi actually it's very ini sih, it's nice to like let it out gitu sebenarnya. I think this really helps me to
more aware.
More aware of what I'm feeling gitu.
Nice. Thank you, Angel, for your sharing.
To conclude today's presentation, I would like to share this remark, which I believe encapsulates the entire notion of the integrative thinking in assisting our patient or client, specifically anxiety disorder. It takes a village to provide health care for a whole person. Hope it's helped. Thank you so much for attention and presentations. And I hope if you have any question, please raise your question or you can email me. This is my email address. I'm welcome for the question. Thank you.
Hi, welcome on stage, Dr. Mariana. There are some questions. I think a lot to do with what kind of client is suitable for this therapy. Is it the older one or the younger one? And is it for people who are more sensitive to touch? Or what kind of people?
I think Sandplay therapy works well for everyone, even the children's and adults. Because I work with children and adults, so I know that it's very effective. Even though when this Sandplay therapy started, the Sandplay therapy they use it for children, but later on there are so many research show that it is effective work on adult. Therefore, in my research, I work with adult. Yeah,
I see. All right. Is it the same as sandbox therapy? Sandplay and sandbox?
this question also raised up in every training.
Yeah.
It's different.
Oh,
yeah.
It's different.
Yeah.
All right.
So to be more clear, I think that there is some question regarding how do we get the training in Sandplay therapy. In Singapore, there are an organization or institute who provide Sandplay therapy training. But in Perhati, we also organize training next year for foundation class. Yeah, if someone wants to know more. But specifically, I would like to address about Sandplay and Sandplay. It's a bit different. Yeah, because Sandplay therapy is a union. What I'm saying, what I'm talking here in this workshop is a union Sandplay therapy. It's not a Sandplay. Yeah, but we can use Sandplay also integratively if we want to use it in counseling. Yeah, but it's different. Yeah.
So can I ask a follow-on question? The people who go for training for Sandplay therapy, must they already have basic counseling training?
If they already have a basic counseling, it will very, very helpful for them. If not, it's okay too. Yeah, but I think for union Sandplay therapy, there is very strictly that you need to go to to follow the step in training. Yes. Yeah.
I see. Okay. Another question is, can it be done online?
that's I think that so far cannot, because this is a very experienced therapy experiential therapy. Yeah, and then you know that we use a lot of miniature, and how do we, because we need to select the miniature, and then
the figuring to put on the sand.
Yes. I think that's for the future. We hope that we can do Sandplay through online. Yeah, but I don't think so. Yeah.
Yeah, so that holds for the training as well, right? Dr. Mariana, you mentioned you're going to have training. So that training, can it be, can we attend the training online?
Oh, yes.
Training, yes.
Yes, yeah, but we cannot do Sandplay, by online, yes.
I see. What about question with hygiene? Now it is COVID. How do we make sure it's clean?
Yeah, that's a good question, because in this pandemic, actually in my clinic, and think that in US also, my colleague in some countries also, we clean our sand. Yeah, we clean our sands every week. And then another thing that there are some procedure, health procedure that they need to do it before they do the therapy, like clean your hand, use mask, then they need to give some, we will ask them, do they have a fever or not? And then the healthy procedure, that we will take those information first before they do the session. Yes, in this
There
pattern.
there is also a question that at which point the healing happens. The client has to talk about it after they do the sand picture, right?
Yeah.
When does healing usually happen?
Yeah.
At what point?
Yeah.
After how long? Yeah.
That's very good question, because everyone has their own issue, and we cannot generalize that this person in 10 sessions they finished, they got healed, and then for another we cannot generalize everyone, because everyone has their own issue and condition very different. Even though there's an anxiety or depression or trauma, everyone, because we have a different background, predisposing factor also is very different. So how do we know it? Every therapist, they use their own style in working on the issue. But for me, because I'm also a researcher, I will use assessment previous, and every 10 session, I will assess again. Because this Sandplay, we cannot interpret the trait. We only listening and reflect, and so I use assessment. Then I can so they can they know how far they have been gone in their process, and through the symptom. Yeah, they can see from the clinical assessment. So that's what I'm doing in my therapy. Yeah,
I see. Thank you so much, Dr. Mariana. That's about all the time we have because we have another workshop coming up. There are still some questions in the chat group. We will encourage participants. You may write the question directly to Dr. Mariana on that email address that she showed earlier. We will put that on the chat as well. Thank you. Yes.
In this October, we will have a training, a very short training, a day's training, 4 hours training, that they can, if they want some information from me, so they can write email. Thank you.
That's very helpful. Thank you, Dr. Mariana.